system, my brother. Yeah. I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up, yeah. Cause no man's alone. Do what's right, alright. Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up, to roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernice Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
You know, it's me, Mr. HE, and I'm here with one message: roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear our face mask, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
Too, because I like traveling and I like to move about. I don't like to be locked up. If it means then that the place is going to be open, I could go out on weekends, I could take a lime, well, that is really why I took the vaccine.
Minister of Health, the Honorable Akila Byron Nisbet, Permanent Secretary in the Ministry of National Security, Mr. Osman Petty, Commissioner of Police, Mr. Hilroy Brandy, Commissioner of Corrections at Her Majesty's Prison, Mr. Terence James, National Security Advisor, retired Major General Stuart Saunders, Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, Chief Medical Officer, Dr. Hazel Laws, and members of the media present here today. Welcome to this joint press conference between the Ministry of Health and the Ministry of National Security. This press conference was convened to look at the situation, the developing situation at Her Majesty's Prison. Today we have a number of key speakers, starting with the Honorable Akila Byron Nisbet, the Minister of Health. Then we'll have the Permanent Secretary, the Ministry of National Security, followed by the Chief Medical Officer, and then the Commissioner of Corrections at Her Majesty's Prison. I want to thank you very much for joining us for this press briefing as we continue to update you with the most up-to-date information with what is happening in the Federation with respect to the management of the COVID-19 pandemic. Without further ado, I would invite to the podium the Honorable Akila Byron Nisbet, Minister of Health, and the order will follow.
Thank you very much, and good afternoon to all viewing and listening. I know that Mr. Williams would have indicated that we're here specifically to speak to the situation relative to Her Majesty's Prison. However, I wish to update the general public on our situation relative to COVID-19 in general. At about 12:14 p.m., we received word that the Federation of St. Kitts and Nevis has recorded its first death as a result of COVID-19. We wish to extend condolences to the family and loved ones of the dearly departed. We have repeatedly said that we are not immune to the ravages of COVID-19, including severe disease and death. Just yesterday, we were reminded of the significant milestone crossed in the United States of America, with them having over 600,000 deaths. The vaccine prevents us from getting seriously ill and dying from COVID-19. While we mourn the loss of our first citizen, my trust is that this will serve as a wake-up call for all. Over the last 12 hours, we obtained results of 28 positive tests, with 26 in the prison and 2 in the general population. COVID-19 continues to pose a threat to every sector of society and all of its institutions. We have said that in addition to the adoption of COVID-19 appropriate behavior, that is, wearing your face mask, hand hygiene, and social distancing, our best protection against this highly contagious and deadly virus is the vaccine. The Ministry of Health took proactive steps in February to have everyone in our institutions, including those at Her Majesty's Prison, vaccinated. The health team visited the prison on several occasions to have all the inmates and staff vaccinated. We had said repeatedly that persons working at these institutions have a moral responsibility to get vaccinated. We also impressed upon the inmates and their families the importance of being vaccinated, as with the imminent threat of community spread faced back in February, the vaccine was our best defense in preventing an institution outbreak. Sadly, the issue of vaccine hesitancy also exists within institutions like our prison and among the staff. While some heeded the call and got vaccinated, there were many who refused. Today, it's my task to inform the general public that we have a cluster within our prison. The prison has been closed to visitors since the pandemic started last year. This outbreak was inevitable without 100% vaccination coverage of all entering the prison. This cluster in the prison underscores the importance of persons working in essential positions where they are in contact with persons dependent on them for protection to be vaccinated. We continue to urge adults over the age of 18 to get vaccinated, not just to protect yourself, but all those who are dependent on you for protection. Every essential worker also has a moral responsibility to get vaccinated. We will only win this fight if we all play our part, as the singular action of an individual affects us all. The Ministry of Health, working in collaboration with National Security, is addressing this outbreak with fierce urgency to bring it under control. The infected inmates are isolated and continually being monitored for symptoms. We continue to monitor and test other inmates who have been separated from those involved in the cluster, and also continue to encourage them to accept the best defense that could be given in this fight, which is the vaccine. The Ministry of Health continues its efforts to keep each and everyone safe. We also need you to do your part. You can help us by following all protocols and, of course, to be vaccinated. Thank you.
Honorable Minister Byron Nisbet, Minister of Health, Chief Medical Officer and other members at the head table, Commissioner of Police and other distinguished government ministers, government officers here, members of the media and the viewing and listening audience. Over the last 4 weeks, since the COVID-19 community spread began, the National Security Advisor, Major General Saunders, and I have had regular meetings with the Commissioner of Corrections and staff of Her Majesty's Service Prison, discussing plans to prevent an outbreak in the prison, and to, in the event that there was an outbreak, to take action that was required. This morning, given the situation of more positive cases being confirmed in the prison, I chaired an emergency meeting to discuss the situation and determine what measures are to be taken to deal with the outbreak. At the meeting, we had the Honorable Minister of Health, the Honorable Akila Byron Nisbet, Dr. Hazel Laws, the Chief Medical Officer, General Saunders, Mr. Abdul Samuel, the Chair of the COVID-19 Task Force, the Commissioner of Corrections, Mr. Terence James, and other senior officers of Her Majesty's Service Prison. I am pleased to announce that we have identified suitable arrangements for the isolation of prisoners in the prison who have tested positive for COVID-19, and measures to address any future occurrence or any more persons being tested positive. Dr. Laws outlined the current situation at the prison and what actions would have been taken to identify and deal with the outbreak. And Mr. Terence James also indicated what measures had been taken. At this time, I'm pleased to invite Dr. Hazel Laws to make a statement.
Please allow me to adopt the protocol so ably established. I want to extend a warm good afternoon to everyone. This afternoon, it's my duty to share with you the Health Emergency Operating Committee's situation report for today, Thursday, June 17th. The Federation of St. Kitts and Nevis is presently trying to contain the current wave of COVID-19 cases. Between May 19th to yesterday, June 16th, we have recorded 234 additional cases. So 234 cases have been added to the Federation's COVID-19 tally over this 4-week period. The graph on the right highlights the number of cases added daily. And so yesterday, June the 16th, we received positive results for 28 persons, inclusive of 26 positive cases related to inmates at Her Majesty's Prison. The preceding day, on the 15th, we received 18 additional positive results. So let me repeat, over this 4-week period, we added 234 cases to the Federation's tally. During this time period, we have also had 25 cases recovering. So within this 4-week period, a total of 25 cases have recovered. At present, a cadre of case managers and physicians are monitoring 208 active cases. So at present, we have 208 active cases being closely monitored. Over this 4-week period, we've had 12 hospitalizations, COVID-19 related hospitalizations. Please note that 7 of these cases have since been discharged. So, so at present, we have 5 cases in hospital. And as the Honorable Minister of Health, Mrs. Akila Byron Nisbet, just highlighted, at about 12:14 this afternoon, we were notified of the first COVID-19 related death. This slide summarizes our current situation on the ground. So at present, St. Kitts and Nevis, we have reported 279 COVID-19 cases, 264 reported by St. Kitts, for St. Kitts, and 15 cases noted in Nevis. 208 of these cases are active, and as I said before, currently we have 5 COVID-related cases in hospital, and we recently noted our first COVID-19 related death. Now, just to provide you a summary about the outbreak, COVID-19 outbreak at Her Majesty's Prison. So on June 9th, we identified the first case in this outbreak. On June 11th, we identified 8 additional inmates who were found to be positive. On June 15th, 2 cases. On June 17th, 26 cases. So in total, we have 37 inmates diagnosed with COVID-19. These cases have all been notified. These cases are being monitored as we speak. These cases have been separated from the general population. They are in Her Majesty's Prison. What's the way forward? And so we continue contact tracing in the prison. Other inmates who are experiencing symptoms will be tested. So there will be serial testing of inmates in Her Majesty Prison so that we can pick up additional cases at the soonest. All the cases that have been identified in isolation, all the implicated cells have been, well, 4 have been. The additional implicated cells will be professionally sanitized. And so we would continue monitoring all the inmates at Her Majesty's Prison at this time. With respect to the outbreak, at present, our overall aim is to flatten the curve. And as I said yesterday, we have employed there are 4 public health interventions that we have employed. We continue contact tracing, that's number 1. We continue testing. We continue our COVID-19 vaccination rollout. And then there is the restriction of movement over this 2-week period. Now, in terms of our vaccination rollout, as at end of workday yesterday, we achieved or attained the following coverage rates. So 66.3% of the target population has been covered with the first dose of the AstraZeneca Oxford vaccine, and 31% of the target population covered with 2 doses or fully vaccinated. So more specifically, 10,255 persons within the Federation are now fully vaccinated. And so this is good. This is a success because this just highlights the proportion of individuals with acquired immunity on the ground. This in and of itself will help to break the chains of transmission of the COVID-19 virus. And so I want to pause and speak to those of us who are virus-free or who have not been diagnosed with COVID-19. What can you do to prevent yourself picking up this virus? What can you do to protect yourself from this virus? So if you are not yet vaccinated, we want you to empower yourselves with the latest information or the facts about this vaccine. Come on board and accept the vaccine. We want you to wear a face mask at all times. It provides significant protection from the virus. Maintain adequate hand hygiene and maintain a safe physical distance of 6 feet or more from others when in the public domain. And then over this 2-week period, a period of strict restriction, we want you to stay at home for as much as possible, and you're only asked to leave if it's for an essential reason or purpose. Those who I want to speak to those who have been diagnosed with COVID-19. Now, what are the actions we recommend at this time? Well, first and foremost, we want you to continue boosting your own immune system, because this will help to facilitate speedy recovery. Make sure to eat and consume healthy meals with adequate or the recommended portions of fruits and vegetables. Make sure to maintain adequate hydration with simple water. Make sure to get adequate rest and exercise. Please note that exercise is a your last exposure to the case. And so this is very, very important. Next slide. We recommend that if you have any issues regarding your COVID-19 testing, you can call the 311 operator. And now I want to pause and speak specifically to persons who are fully vaccinated and who may be deemed contacts of COVID-19 cases. So if you are fully vaccinated and you was exposed to the virus, meaning in contact, close contact with a COVID-19 case, we want you to be tested. There's an initial test and a test 7 days post your last exposure to the COVID-19 case. So testing is important. Now, you do not have to particularly be in quarantine. However, we must test you, especially that last test 7 days post-exposure to the COVID-19 case. So that's very important for us to note. Ladies and gentlemen, this is real. We are in an outbreak. We are at war against this COVID-19 virus. We need all hands on deck, and we want us all to do our part in protecting ourselves. And so we need to vaccinate if we have not yet done so, And we need to be very serious about wearing the face mask, hand sanitization, and physical distancing. Each day, when we receive additional positive results, it tells us that these individuals were not in full adherence to the COVID-19 prevention and control measures. So if you wear your face mask and you're very serious about that, diligent about that, maintaining hand hygiene, your risk of contracting the virus will be considerably low. And then chances are your name won't make the list of positive cases. So ladies and gentlemen, the one takeaway point is, if you are virus-free, do all you can to remain virus-free. Get vaccinated, wear a face mask, keep your hands clean at all times, maintain a safe distance from others. If you practice these measures, you can and will remain virus-free. If you practice these measures, you will be doing your part in helping us to get out of this crisis. Let us all come together and fight this virus and contain this outbreak. I thank you.
Good afternoon, everyone out there in radio land, TV land, whichever platform you may be listening or hearing this broadcast at this time. Ladies and gentlemen, I want to adopt the protocol that was already established. The management and staff of Her Majesty's Prison has worked hard to protect the health of our staff and residents since the announcement of the first confirmed COVID case in the Federation from March 2020. According to the World Health Organization, WHO, people in prisons and other places of detention are likely to be more vulnerable to COVID-19 outbreaks than the general population because of the confined condition in which they live together for a prolonged period of time. It was with this risk factor in mind that we implemented a number of measures to safeguard the health of prison personnel and residents early, which include: 1, developing a plan for officials from the Ministry of Health; 2, requiring all members of staff to wear masks at work; placing sanitization stations throughout the compound for easy access; briefing staff on situations and apprising them of health protocols that were put in place; hosting a presentation for residents, a local doctor and health expert from the Pan-American Health Organization. We temporarily suspended all outside trips for residents of Her Majesty's Prison, and we established a quarantine area where new residents would be housed for 14 days before we placed them in the general population. We were quite successful in able to prevent the introduction of the virus into the prison for just over a year and 2 months. Her Majesty's Prison recorded its first confirmed case last week on June 10th after the return of a resident's test results. The following day, the test results for 2 members of staff were positive as well. Authorities in the Ministry of Health have been testing both personnel and residents. A mass testing exercise was conducted on Tuesday, June 15th, when members of the National COVID Task Force and representatives from the Ministry of Health visited Her Majesty's Prison. While testing has not yet been completed, more than half of the staff and just about half of the residents have been swabbed. As of today, June 17th, 2021, a total of 37 residents, inmates, and 2 members of staff have tested positive for COVID-19. Please note that only the male block in Her Majesty's Prison has been affected. The female section of Her Majesty's Prison has not been affected at this time. Other staff members who had been identified were placed in quarantine and tested. Thankfully, this result has returned negative for the members of staff so far. As a result of this, we moved swiftly to implement measures to protect the health of personnel and residents. I want to assure the general public that we are doing everything we can to safeguard the health of all concerned at Her Majesty's Prison. My management team and I have been working closely with the National COVID-19 Task Force and have been receiving advice from the CMO, Dr. Laws, and what steps to be taken to contain the situation at Her Majesty's Prison. An isolation area has been established inside the prison where affected residents have been placed, and we are currently identifying additional space to house those who need to be removed from the general population to prevent a further spread of the virus at the facility and to have a speedy recovery for those who have been tested positive. All the cells in which the affected residents were previously housed have been professionally sanitized. At the moment, no items have been accepted at Her Majesty's Prison at this time. The affected persons are all in stable condition. The residents in isolation are receiving good care thus far, and we have upgraded their intake of supplements. The prison doctor makes regular checks on them and any other inmate who has health-related complaints. I would provide the doctor with regular update as to what is happening at Her Majesty's Prison. The St. Kitts and Nevis Prison is the last prison in the region to be affected with the COVID-19 virus. So we have tried our best to keep it out of Her Majesty's Prison, but we knew this would have happened despite the challenges. We continue to do what we can to protect the health of the residents and staff at Her Majesty's Prison. The management at Her Majesty's Prison has also been encouraging personnel and residents to be vaccinated and have facilitated on-site vaccination with assistance from the health officials. So far, just over half of the staff have received their first dose, with about 33% fully vaccinated. Approximately half of the residents also have received their first dose, with about 36% fully vaccinated. So we have been trying at Her Majesty's Prison to do what we can to keep this virus out of the prison. We are trying our best at this time to isolate and contain Her Majesty's Prison, and we will try our best to continue doing this until we are fully recovered from the outbreak inside Her Majesty's Prison. Thank you.
I thank all the speakers who presented. This brings us to the question and answer segment of this press conference. We have media who are present here with us, and I would first invite them to ask their questions. However, we also have a WhatsApp number, which is 662-3604. That is 662-3604, where you can send your questions. Additionally, you can send your questions to ZIZ YouTube and Facebook. I think it's www.zizonline.com. You can send your questions there as well, and they will be addressed. For the media, you should first identify yourself and your media house when you come to the mic to ask your question. I would allow one question at a time from each media house in the first round. And in the second round, you can ask another question. I now invite your questions.
Good afternoon, Glenn Bart, SKN Newsline. On behalf of SK Newsline, we want to extend our deepest sympathy, condolences to the family of the person who passed away as a result of the COVID-19 virus. My question is, with just a few days left, really in the 2-week period of time under this current lockdown, are we likely to see a turning point in the arrest of the spread of the COVID-19 or the rate of spread within the next few days? And is it likely then, if not, is it likely then we'll run into a situation where we'll have to extend the current arrangements?
Who at the table would like to take that? Dr. Laws?
Very good question. Over this 2-week period, we are going to be continuing our contact tracing process, our testing. We are going to be continuing our vaccination rollout. And so within this 2-week period, we hope to see significant containment of this outbreak. Dr. Wilkinson?
It's very easy to ask a question like that, but what I want to tell you also is that the turning point depends on you and me. The Ministry of Health, the government cannot do this on its own. We keep saying that the singular action of an individual affects us all. And so if persons do not do the simple things that we've been asking them to do, we can come to the end of this 2 weeks and not see a decrease in the cases. A shutdown or lockdown will only work if people choose to lock down. And the government cannot micromanage every single person. And so we keep getting calls from people, despite the fact that we are saying that the virus cannot move without your help. They're trying to move to X and Y and Z. And so we can only get out this safely if everybody play their part and stay put and don't move unless you have to move.
I want to repeat the WhatsApp number that questions can be sent. The number is 662-3604. I repeat it, 662-3604.
Good afternoon, German Abel, SKN Vibes. Mr. Moderator, just excuse me, I want to ask a two-part question. This is directed to the CMO or anyone at the table. This has to do specifically with law enforcement and quarantine facilities. We're seeing that there's an outbreak in the prison and 1 or 2 staff members would have tested positive. What checks and balances are there in place for law enforcement agencies if they go out? For example, the police would be out doing their checks to ensure that people follow the curfew. Is the task force or the committee ensuring that whether it be the police, the army, the Coast Guard, or any one of these law enforcement agencies have quarantine facilities should a member of either of those branches of law enforcement come into contact with an individual? Or is it a case that they would go home and self-quarantine? The second part of that question has to do specifically with for the prison, basically. Define serial testing within the prison facility. Because if you're saying serial testing and you're only testing those, or are you testing those who would have been confined in the area with those 4 blocks, or is it a case that the health officials are testing the entire prison under this quote-unquote serial testing?
Okay, so serial testing. So we've identified a number of positive cases in the Her Majesty's prison, and so we are they are in isolation. They are in isolation at the prison, and so we are monitoring them in terms of their recovery. And so the other prisoners who are negative, they are being monitored closely for symptoms and tested accordingly. And so they'll be tested serially. All right, so every couple of days we will be conducting tests on inmates within Her Majesty's prison. So that's what I meant by serial testing. In terms of law enforcement, I leave that to those in that area. But what I want to say is, if in the at this point in time, if you come into contact with anyone right now, you need to consider that individual a possible carrier of the virus, and you need to do all that is required as recommended. Wear your face mask, hand sanitize, maintain a distance. So if you're law enforcement or not, even in the media, when you come into contact with anyone, you need to be appropriately attired. Face mask, hand sanitization, physical distancing. Now, if a law enforcement officer is in contact, or if there is significant contact with a case, somebody who is diagnosed with COVID-19, the protocols, the established protocols must be followed. That individual will be asked to go into self-quarantine and tested as outlined before. Thank you.
And I think it's important to add, and the Minister of Health said it in her speech, that every essential worker should be vaccinated. And so every law enforcement officer, his best protection, in addition to wearing the mask and hand sanitizing, is being fully vaccinated. And so if one is fully vaccinated, one can come into contact with someone who has COVID-19 and not get infected. Or even if you do, your risk of getting seriously ill or dying from COVID-19 is significantly reduced. I hope that this first death that we have is a wake-up call. I wrote on a Facebook post the other day saying that we are the ones with the brain, not the virus. I want people to wake up and take this thing seriously. We need to unite in this fight against the virus. We understand that we have differences, but we can put our differences aside and have a collective effort in fighting this virus. Otherwise, we will have other deaths.
I really want to use this opportunity to ask the media to come on board with us, media personnel, and use every opportunity you can when you are speaking to the population to reinforce the COVID-19 prevention and control measures and reinforce the importance of coming on board in terms of vaccination.
This question is from Freedom FM. With quarantine facilities full, what new facilities are being mobilized to deal with the additional cases? And how is the JNF coping with COVID-19 cases? Are other patients there at risk?
We are currently in the process of identifying more quarantine sites. The task force is taking every effort. We have had a number of individuals and companies who have reached out and offered up their apartments or their hotels to assist in our quarantine space. And I know that Mr. Samuel and the team with the task force continues to reach out and have a number of interviews, viewing places, getting an idea of what we have available so that we can come back and speak to the numbers, the total numbers of quarantine space that we have available. I want to take this opportunity to thank all of those persons and companies who have been stepping forward and assisting us with more quarantine space. And if anybody else wishes to do the same, I'm asking them to call 311 and be able to have your information relayed to the task force so that we can make that phone call and be able to come and inspect your site to make sure it will be adequate for quarantine. In terms of the hospital, we have the ward at the hospital specific for COVID-19 cases. They do not mix with the other population within the hospital. The nurses and doctors who work with those patients are properly protected, and they do not intermingle between wards. So I just want to make that clear to the general public. We do have a COVID-19 ward where all of those patients are kept away from the general public.
I also want to add that on the COVID-19 ward, or on the respiratory side of the emergency room where patients come in with symptoms, persons working there are much safer than someone who is in the general public, because there you know that these persons are infected and you have the appropriate PPEs and you do what is necessary to avoid getting infected. And most of the persons working in these institutions also, they are vaccinated. You in the general public, with us having community spread, you have to assume that every other person out there that you're coming in contact with has COVID-19, and that is the way we will prevent it from spreading. And so the risk is not just on the ward where we know persons are infected. The persons who are walking around in the general public who might have COVID-19, they don't have a label on their forehead saying that they have COVID-19. They're not wearing a particular color. They're not a particular shade. They're not a particular political persuasion. You need to assume that everyone is positive, and you wear a mask to protect yourself, and you go and get the best tool that you have to fight this virus, which is getting vaccinated. And if we have a significant proportion of the population vaccinated, anyone who is concerned about the hospital, by going forward, you would ensure that our healthcare system is not overwhelmed. The only how we can do that is making sure that the majority of the population is protected, such that we would not have a significant number of persons coming in with severe disease.
Jason Davis, ZIZ Broadcasting. Dr. Laws mentioned a series of tests for the residents of Her Majesty's Prison. Simple question, who's paying for these tests?
Very good question, Jason. The state.
This question came on the online platform. Would the vaccine protein behave like smoking? Secondhand smoke also impacts non-users who mingle in close environments. Will all become vaccinated directly and vicariously? Dr. Wilkinson.
The short answer is no. When we speak about persons getting protected by other persons being vaccinated, we're talking about the concept of herd immunity, where if we have 10 persons in a room and 9 are vaccinated and 1 is not, if an infected person entered that room and came into contact with those who were vaccinated, the virus will stop. The persons who are vaccinated are like the speed bump on the road of a speeding car, the speeding car being the virus. And every time the speeding car comes into contact with a bump or somebody who is vaccinated, the virus is forced to slow down, the virus is not transmitted. So the protection is not transmitted vicariously, but by the herd immunity. And so that's why we said, for example, every teacher in the education department should be vaccinated, because by they being vaccinated, they would prevent the transmission of the virus into the school. Every healthcare worker should be vaccinated so that they can protect those who they are entrusted to protect. There is no reason why you should be looking after someone who has a non-communicable disease like diabetes or hypertension, but putting them at risk for a communicable disease, especially a deadly one like COVID-19, by not being vaccinated.
There is one question in relation to the British Airways flight and when it will commence into the Federation. And I must report to you that the travel advisory has been extended for travelers from Brazil, the United Kingdom, South Africa, and India. That is the most recent press release from the National COVID-19 Task Force. That travel advisory takes effect from June 12, 2021, and it is extended for an additional 14 days. This question has to do with the person who died. What was the vaccination status of the individual who died?
I want to extend my sympathies to the family and the close friends of the person who passed away, and we're going to use this time to give them their space right now so that they can mourn, and we will not be answering any questions at all concerning the deceased at this point in time.
Are returning nationals who are traveling from England allowed to enter the country?
Yes, returning nationals are allowed to enter the country no matter where you are coming from.
Jason Davis for ZIZ Broadcasting once again. Has a definite decision been taken on the cruise vessel that was supposed to visit shortly?
We've taken the decision to postpone our cruising activities until we're able to get past this crisis that we find ourselves in. And so once we are comfortable that we're in a position where the country is back to we're out of this crisis, then we will begin speaking to the cruise industry once again.
Good afternoon, Jared Abel again. Two questions. One, firstly, to Superintendent James. Now that there is an outbreak in the prison, there's been talk some time ago about early release. Is that still on the table? And I know this is a prison press conference, but you know, we heard of one case recently within the police force. Can we hear from either of the two gentlemen here about what measures are being taken and how are they dealing specifically with those officers who are out and about doing, you know, stop and searches and enforcing the protocols?
At this time, there has not been any consideration or any plan to have early release, but that is something that can be up for discussion at this time. But presently, no plans have been made formalized to have any early release at this time. Our major thing right now is to try and contain the COVID-19 that has taken our prison presently. Thank you.
Like Mr. James said, there has not been any prisoners, but it is something that needs to be looked at shortly to free up some space in the prison. But this is something which is which requires a lot of legal advice in how that is done. But it's not off the table, and I believe in due course we will get to that. Mr. Brandy is here. I don't know if he wants to make any comment. I am not aware of any special arrangements for law enforcement, except to say that they should be following the protocols outlined by the Ministry of Health, wearing their masks and sanitizing, etc. I think someone asked about quarantine. As far as I know, those persons within law enforcement who have been diagnosed with COVID are quarantining at home, and there's no special facility for them. But Mr. Brandy can give us an opinion, please.
Good afternoon. Thank you, Mr. Pierce. I wish to inform the general public in terms of our organization. I think our organization is one of the first to reach the hurdle of a herd immunity in terms of 72% of our officers are have been vaccinated, at least with the first shot. In terms of officers doing the duty, stop and search, and carry out the necessary protocols, very early o'clock, our officers receive memo from the High Command that when out on duty, they must carry sanitizer, gloves, and masks. And the mask must be worn in the proper manner as described by the policy. So there is no problem in terms of our security force in carrying out their mandate.
This question is for Dr. Laws. Dr. Laws, I am going to ask this question again, even though it has been asked 1 billion times. And I want you to reiterate what has been said over and over again with respect to the medical science. Dr. Laws, how have unvaccinated people been affected versus vaccinated people?
Okay, how have unvaccinated persons been affected versus vaccinated? I happen to have the list of all the cases, the COVID-19 positive cases reported, registered by the Federation thus far. And anecdotally, a majority of the cases are unvaccinated. What I realize is that being unvaccinated makes you vulnerable to the virus. And so that's my answer. When you're unvaccinated, you're vulnerable. So we are preaching to the vaccinated, the unvaccinated. Empower yourselves with the latest information about the vaccine. Come on board, accept the vaccine. Those who have gotten the first dose, pay attention to your appointment. Or let me just add, utilize this forum in adding, those individuals who have come on board during the month of March and received their first vaccine. Right now, your second vaccine, your second dose is overdue. So we implore you to come in to get your second dose. Those of you who have come on board and received your first dose between the 1st of April to round about the 9th, 10th of May, you can also come in now to receive your second dose. What I'm saying is, if you received your first dose during the month of April and the first week or two of May, you can come in now, come early to get your second dose. You don't necessarily have to wait until the last week of June to get your second dose. And so if you're unvaccinated, you are in a vulnerable position while we are in community spread. Come on board, be vaccinated to protect yourselves.
Thank you, Dr. Laws, for availing yourself time and time again to answer that same question. These two questions, I would invite Superintendent Henry to answer them. I was just wondering if anyone is allowed to exercise on the road at mornings. What is the reasoning behind not allowing lone individuals to go out for a walk or a run when physical health is crucial to beating the virus? Individuals are not disciplined or motivated enough to work out at home.
Thank you for that question, Mr. Williams. The previous public health regulations provided for persons to exercise. However, unfortunately, the new regulations that we are operating under, the emergency powers regulations, it doesn't provide that privilege. In fact, there's a shelter-in-place provision in that regulation which requires persons to stay at their residence unless they are moving for essential purposes. That is between the hour of 5 a.m. and 6 p.m. And it defines essential purposes, and exercising is not included as among the within the definition for essential purposes. So with that, persons are required to exercise at home. You can use your entire yard space for that purpose, but venturing out on the street for that purpose is not permitted under the new regulations. Thank you.
These following two questions, the first one would be for P.S. Petty, and the second one would be for either Dr. Laws or Dr. Wilkinson. Can't the prisoners be removed from the prison and placed in an isolation center with security? Please remember, these are human beings we are talking about. And the second one, according to the World Health Organization, the vaccine is supposed to be taken in 8 to 10 weeks. Why are we now having people to take the second dose of vaccine in 4 weeks? Isn't it a reason why they said 8 to 10 weeks?
I would ask Mr. James maybe to give an input here also. This morning we looked at all the options available, and it was found that there is adequate provision, there is adequate space and facilities within the prison compound for isolating prisoners who are positively diagnosed with COVID. And there are also ways of isolating those who are negative. In terms of getting them out of the prison, that has also been discussed, and it is an option on the table if it comes to that, if that is required. But there are security issues involved, and maybe Mr. James can come and give an opinion on this. But as it stands right now, there is adequate space within the prison and adequate facilities that can be used to comfortably house those persons who are positive and separate those who are negative. Mr. James.
Okay, yes, we have looked at some of the challenges that we have in removing the inmates from Her Majesty's prison. Yes, they are human beings, and we're going to treat them like human beings by law and the Prison Act. Anywhere that we transfer inmates, staff must go. And so if we take a high number of inmates out of the prison, we have to split our staff to accommodate, to provide security at these institutions. Okay, so that was one of the challenges that we looked at. Yes, at this present time, we have 37 cases of inmates tested positive, and we think that we still are able to isolate these 37 inmates inside the prison with the spacing that we have so far. We are looking at a worst case scenario, so that if we get to that worst case scenario, then we might have to resort to removing some from the prison. But at this present moment, we think we have the capacity of housing, of isolating those that are tested positive, and those that are tested negative, we can keep them in the general population at this time. So we think what we have now, we are capable of housing them inside the prison compound at this time still.
All right, so regarding the question about the vaccine, based on the insert or the directions from the manufacturers of the AstraZeneca Oxford vaccine, this vaccine is has a two-dose regime. So in other words, you give the first dose and then a period elapsed between the first dose and the second dose. The recommended interval between first and second dose is as short as 4 weeks or 1 month to 12 weeks or 3 months. And this is as recommended by the manufacturers of the vaccine. And so we are following the recommendations of the manufacturers. And so we can give a dosing interval of 1 month, as short as 1 month, or it can be extended to 12 weeks or 3 months. Now, I want you to also recognize that there's one constraint. The vaccines we have in hand expire by the end of June. And so persons who came on board and accepted the vaccine within the last month and a little, beyond, their interval would naturally be shorter than the interval offered to acceptors who came on board in February, March, and early April.
I will ask these two questions, and maybe the Honorable Akila Byron Nisbet can answer them since she's the only Minister of Government here. Will there be any more stimulus package given out for those who are not working due to this lockdown? Will any school meal programs be in place for children whose families do not have it to supply for them?
In terms of the stimulus package, as we receive more information, of course, this is a fluid situation that we're dealing with. And we are trying at this time to overcome the current crisis, which is the number of cases that we have on island at the moment. Discussions will take place and the necessary actions will be taken, and that will be communicated. As it relates to persons seeking relief, such as meals or being able to be provided with meals, if you dial 311, give your information, we can then have social services who is assisting as it relates to being able to provide packages, care packages and meals. They will be able to reach out to you to add you to the list of names of persons who are receiving care packages and meals. So you call 311 and then you can be guided from there in terms of being in contact with social services, which is the arm of government that at this time is engaged in assisting persons with care packages and meals. Thank you.
Glenn Batt from SK Newsline once more. Two questions. One has to do with the prison itself. We often hear about the risk of persons bringing the virus into the prison. With the shutdown of visitors, now we also have the situation where there are workers interacting with prisoners and so forth. What is the level of risk of the COVID-19 getting out into the general population of the country? thus providing another spark of infection going? Secondly, can you talk to any pattern of infection that is developing within the general community, including the business community? We know of some outbreaks within certain businesses, and I think there was a situation with Scasper itself. Could you comment also on the latest development with Scasper? Thank you.
All right, in terms of the virus getting out into the public, for the last 3 weeks or so, going on to our fourth week, our prison has been closed in terms of inmates moving in and out of the prison. So the inmates was not on the outside during the last three to 4 weeks or so. We can reasonably assume or presume that it was an outside individual taking it into the prison, which would have been possibly a staff member, because the staff, after working, they go back home and then they return to work following after their day off at work. So we reasonably think that it could have been a staff member that would have transported it inside the prison, because the inmates were locked down for at least for the last 3 weeks. In terms of any of the COVID getting from inside of the prison outside, well, all of the inmates presently are isolated, so those inmates don't have any chance of going out of the prison. Any staff member who interacts with the prisoners at this time has to be properly suited down in their PPEs and their protective equipment. So we are doing as much as we can to isolate and contain those inmates that are affected in that area. We're thankful that the staff member that was tested in the mass testing on Tuesday, the results came back negative for those members of staff. So we are thankful for that, and that no other staff member has tested as positive apart from the 2 that was tested as positive last week, Thursday or so. So that's what we're doing at this present time.
Dr. Laws, these next 2 questions are for you. I know that you said that data was being gleaned for this one. How many of the positive cases have been vaccinated? Is there any information on that now? And the second one, do we know what variant the index case had, and what are the current variants in circulation? I know you said that information was sent to CARTHA for genomic sequencing.
Okay, so very good questions. Well, prior to the previous, poser asked about the pattern of infection and various entities that are implicated. I just wanted to say that we are in community transmission, so the virus is circulating throughout the Federation, and so the virus is now impacting inmates in the prison, but the virus is in circulation in the Federation, and so the virus is out of the prisons already. Now, what is the pattern of infection and its impact on various entities? And so a number of private and public sector entities have been implicated through our contact tracing process. But what's even more important, what are the factors driving this? And it comes down to individuals who work in these entities not adhering to the COVID-19 prevention and control measures. So I wanted to add that. Now, in terms of the data regarding the positive cases and their vaccination status, that data, we are still awaiting that data. As soon as it becomes available, we will share the findings of same. And in terms of the variant in circulation, we sent off 2 batches of samples to the Caribbean Public Health Agency, and we are awaiting the results of the genomic sequencing process.
Okay, we're just going to take a few questions before we wrap up by 3 o'clock. What is the maximum capacity for the private ward to accommodate COVID patients, and how many nurses do we have qualified and fully vaccinated to deal with these patients? That's the first one.
We said from the very beginning that we identified the private ward as the initial place where we would put persons who need hospitalization for COVID-19, and we will command more and more of the institution if the need arose. We have 15 beds on the private ward. I think 5 of them are currently occupied. If the need arises, we would command more of the institution. We saw this happen in a number of first world countries when their health system became overwhelmed. The good news is, though, following the science, the fact that we have a significant proportion of the population, the adult population vaccinated, 66.6%, I think it is, having received the first dose, and 31% having received their second dose being fully vaccinated. This should protect us. However, we have contingency plans in place in case we need to to hospitalize more persons. The question, though, keeps coming up about the cases that are positive and if they are vaccinated. What the CMO said before, although she didn't say it this time, is that we know that the majority of persons who are infected, they are either not vaccinated, and there are very few of them who have had one shot. We are not aware of anyone who has been fully vaccinated, but when we analyze the information, we will come back to you. However, being fully vaccinated does not stop you from getting COVID-19. We have said that repeatedly. What it does, it significantly decreases your risk of getting COVID-19 from 63 to 83%. It significantly decreases your risk of getting severe disease and from dying from COVID-19. And so these should not be gotcha questions where you're trying to see if in that batch of persons who are positive, you're looking to see if there are 1 or 2 persons who were fully vaccinated. In time, if this virus continues to spread, we will have persons who are fully vaccinated who are positive, but that doesn't remove the fact that it will give them significant protection and prevent them from being hospitalized. And so I urge every single citizen who can be vaccinated to go out and get vaccinated today, tomorrow, the day after, so that we can reach that threshold of herd immunity so that we can all be protected.
I want to end with this question, and it's for Dr. Wilkinson. Don't go as yet. I suffer from high cholesterol. I do not take statins as they have adverse effects on me. I therefore use walking 5 miles a day to keep my cholesterol levels down, and this has been very successful. How am I to keep my walking up if that is not essential? I do not have an exercise bike at home. I am fully vaccinated.
I keep saying we are the ones with the brain, not the virus, and we need to collectively fight this virus. We cannot at this point in time draw lines in the sand and say we're going to have X for the vaccinated and Y for the unvaccinated until we reach a critical threshold of vaccination in this country. Everyone will be at risk. We also said we have shared sacrifices and shared benefits. And so we understand that in this 2-week lockdown, persons are going to have to make sacrifices, some more than others. But we're asking everyone to play a part. And so I don't expect to come back up here and answer another question about how someone is going to be inconvenienced. This inconvenience is to save your life, or your neighbor's life, or your child's life. It is to save the entire country.
I thought it was important to add, however, over the next 2 weeks, we're hoping that persons will take the time to understand the severity of what we're dealing with as it relates to COVID-19. And so we are asking you for changed behavior coming out of these 2 weeks lockdown. What that means, we are asking you to please follow the protocols. Wear your face masks once you're leaving home. Practice good hand hygiene. I walk with a small bottle of sanitizer in my bag. I have a bottle of sanitizer in my car. I have Lysol wipes in case I need them. And so this is the way we have to start thinking, because COVID-19 is not going anywhere anytime soon. And we will have to learn to live with it. And so we are asking you over this next 2 weeks to help us, to help you, and to keep you safe, vaccinated or unvaccinated. We need everyone to do their part in order for us to get out of this current situation that we are in and to ensure that we can continue to live with COVID-19, and should another outbreak occur, we would be in a much better position together to be able to overcome. And so the Ministry of Health is simply asking for 2 weeks to allow our contact tracers to do their contact tracing, to allow our testers to be able to keep up with the testing, and so that we can get a better handle on the current situation. Once we are out of that, then we can begin to talk about anything else. But just for this 2 weeks, we're just asking for your cooperation. And once we come out of this 2 weeks, we're asking for change behavior, that persons will continue to follow the protocols, and who can be vaccinated, we are asking you to be vaccinated. Thank you.
I think it was about a year ago, right at this very podium, I read an excerpt from the Ugandan president to his people in this war against COVID-19, and maybe I should read it again. And in his message he said, God has a lot of work. He has the whole world to look after, not just you. He said, in a war situation, nobody asks anyone to stay indoors. You stay indoors by choice. In fact, if you have a basement, you hide there as long as the hostilities persist. During a war, you don't insist on your freedom. You willingly give it up in exchange for survival. During a war, you don't complain about hunger. You bear hunger and pray that you live to eat again. During a war, you don't argue about opening your business. You close your shop if you have time to do so, and you run for your life, and you pray to outlive the war so that you can return to your business if it hasn't been looted or destroyed by mortar fire. During a war, you are thankful to God for seeing another day on the land of the living. During a war, you don't worry about your teenage child not going to school. You pray that the government does not forcefully enlist them as soldiers. The world is currently in a state of war, a war without borders, a war without ceasefire agreements. The virus we are fighting in this war is without mercy. It is indiscriminate. It has no respect for children, women, or places of worship. There are no sacred zones. Its only agenda is to harvest death. Thankfully, this virus has a weakness and it can be defeated. It only requires our collective action, discipline, and forbearance. It is stopped in the face of collective social and physical distancing. It bows before good personal hygiene. It is helpless when you take your destiny in your own hand by sanitizing them. At the time when he delivered the speech, there was no vaccine. We also know now that the best tool against this virus is the vaccine. Get vaccinated. Thank you.
A number of the questions today had to do with personal pleasures, individual hobbies, and things like that. People asking, so why can't I go to the beach? The beach is important for my immune system, and things like that. But I think Dr. Wilkinson underscored that we have to put our personal hobbies aside to look at the common good, the collective good. Because from the minute you are going to allow one person to go to the beach, then that is where the whole thing breaks down. And everybody now will have to be allowed to go to the beach. And as I heard Superintendent Henry said the other day, that initially we were allowed to go to the beach under the new regs. But what happened is that when they go over to Reggae Beach, it was flocked with young persons over at the beach, a number of them over there playing football and all of this kind of a thing. The very same thing that you're trying to eliminate, the mass gatherings and so on, which basically bring about the spread of the virus is, and that is what we have to eliminate. Thank you so much for all of your questions. I want to thank the media for their questions and for their continued partnership with us here in this war against the COVID-19 pandemic. We're at a very critical moment in the Federation, and every help is needed to help us to combat this deadly virus. I want to thank all of our presenters today, starting with the Honorable Akila Byron Nisbet, the Minister of Health. We thank the Permanent Secretary in the Ministry of National Security, Mr. Osman Petty. We thank the Chief Medical Officer, Dr. Hazel Laws, the Commissioner of Corrections at Her Majesty Prison, Mr. Terence James. Additionally, we thank all who came up and answered questions for the public, including the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. We thank Superintendent Cromwell Henry and the Commissioner of Police, those that are trusted with the enforcement of the laws and the regulations which are so important. We thank Mrs. Christmas Jacobs for her valued service of sign language. And we thank the members of the media, and we thank the members of the National COVID-19 Task Force who are here. Thank you to all of you, and we will keep updating you with respect to what is happening with the COVID-19 management in St. Kitts and Nevis. Continue to do your part. Until then, I am Les Roy Williams. Take care.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernice Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
I am.
My name.
I am John.
I am Ash.
Yeah. I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, one people. We are roll up to roll out. Cause no man's alone. Do what's right. Cause I love you. Brother, my sister. And we're in this together. My sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.